I'm undergrad, final year. I'm Stacey.
Hamajam Ahmed Adam. MSc.
Asma, PhD.
So our idea is Pri-Berry care. So it's a bit of a play on words. So we've got Raspberry Pi, primary care. And yeah, I'm really crazy, so you're going to have to excuse me, I'm a bit... So, Chaz spoke to you about Birmingham, so I thought I want to introduce a bit about Birmingham. As you can see, we have the cloud and rain, lots of rain in Birmingham, and we love our tea. Cups of tea all the time. I'm not sure, Finland like tea? More coffee? Yeah, I love. So this is our newest campus. Chaz spoke to you a little bit about it, but I just thought I'd put it in there just as a kind of a welcome from us. So firstly, we had to look at what is mHealth, so mobile health on the go. So Hamajam, he looked at rural areas to start, and we looked at some examples that was done, was it Kenya?
Yeah.
Kenya?
It was in Kenya.
So it was kind of HIV reminders, but as you can see a picture there, there's also visits and follow-ups for maternity or antenatal, etc. There's lots of different things, but just reminders on phones.
Yeah.
But then, who has a smartphone in this room? I'm sure you all have smartphones. You're used to this. Who doesn't one? So there is, in Apple, they have their own feature app store for healthcare. And a study did show that already 86% of healthcare professionals do already use apps in their, and smartphones apps in their professional jobs, day-to-day lives. So what is primary care? So we've got Doctor Who there, if anyone likes Doctor Who. So primary care is the first point of call. So I know we had a team, Austria, who spoke about the heart. So ours is quite similar to this, but we're focusing at the very start. So you could go to a doctor's surgery or hospital, it's the very start, So what would be the benefits of mHealth for primary care? So we looked at not having the need to travel. So you wouldn't have to attend the hospital because we could do it in-house. And rural areas again, which was Hamajam's specialism, we could improve that because obviously in a rural area we haven't got as many surgeries. So in Africa there's probably one place and it's very far to get to, even though it's a small, a small surgery. And it can be relatively low cost in comparison to hospitals because it's the first point of call. Yeah. And we looked at sustainability. So again, cars, just a little kind of every gallon or 3.7 litre. 9 kilograms of carbon dioxide produced, so just to say like how we're trying to tackle sustainability as well. So again, benefits for general public, healthcare professionals. So for healthcare professionals, if you have a solution that's mobile, they could travel, and you get big machines. If we can make this smaller, then we can take it anywhere, so a nurse can take it anywhere. And it's all, the low cost always comes with it. And again, for general public, okay, if you're not a doctor or a nurse, you won't have as much of an idea of what you're actually doing, but we all have tablets, smartphones, you did put your hands up, so it's ready, it's accessible. And you already know, when you download an app, you don't need to read an instruction manual because you know how to use it. So we're all built for apps. We just know, we get a phone, we just like it. Even little children now, they know how to use tablets. So we went to work. This is us in our labs. We're developing our solution, the Pri-Berry care. And this is Dr. Esther, you will see her soon. She'll be coming soon to present. She came to make sure we were doing our work, to keep an eye on us. Because I'm the crazy one, so, sometimes I'm just like, I don't want to do any work, they're crazy. So she came to keep an eye on us. But yeah, this is us working in our labs. And Hamajam, you've got, Hamajam we were making him put stuff together.
And Karen.
Yeah, he was carrying the stuff for us.
I'm the man in the team.
Moi. So what is our proposed solution? So we're using the eHealth sensor that Austria used as well, which is really good. So it's like, oh, we've got something in common there. And we've got all the sensors. I was going to talk to you about those, but I won't repeat myself again, so I'll just lightly touch on them. And there's a smartphone app that already exists, which we'll be talking about pretty soon. So how did we fit the sensor shields together? So this was just a small, it was mentioned previous, so I don't want to go into detail too much, but we just place them, the eHealth sensor shield and the Arduino external shield as well, so that it can multitask. And then all you do is you plug in all the sensors, it's already there, you just have to put the libraries in, which we did. So the sensors, was it 5 sensors that Austria used? 5, so we just kind of used all of them because for primary healthcare we don't know. It could be heart, it could be diabetes, it could be anything, so we kind of need to use all of the sensors because this is something that could be used at home or in a doctor's surgery, so it could be anywhere, and we don't have a specific kind of target illness. So this is the app that already exists that we're utilising, so we didn't really want to reinvent the wheel. So we used this app first to capture some data. So we got Hammerjam to put the breathing sensor up his nose and pulse. Whose pulse was the highest? Was it? Yeah, we was getting angry because we couldn't put it together, so his pulse was like... You're the man, is that what you just said? Yeah. See what I have to deal with. Thought I was bad.
Who's the crazy one from you?
So yeah, we use that. But with every idea, fantastic idea, there's always problems. Always problems with anything. And I'm sure one of you, yeah, you're the one who always knows there's problems. So, it is expensive for home use because, what was it about? The full kit, €300 to €400. So for at home, people might think that's quite expensive, so you wouldn't really want to do that. So that's one of the downsides of the eHealth sensor with the sensors. And users might not have a compatible device, so they might not have Raspberry Pi or Arduino, and they might not have no idea how to use Raspberry Pi, like my mum would never know how to use Raspberry Pi. You was new to Raspberry Pi as well when we started, so it's all different. It depends on the person to person. And we did look at rural areas because that was one of the areas where we thought we could bring it as well. And again, there is the issues of funding and poverty. They don't have infrastructure like most countries like us, so we have really good infrastructure. And there's a lot of people with lots of disease, so it would be relied on quite heavily, so that's one of the issues that we'd have to tackle in rural areas. Advanced areas, I'd like us touched on earlier, the eHealth sensor may be expensive for home use, cheap for surgery but expensive for home use. And again, information overload, so when we started Hammerjam was just, what was this? It's just like... And again, some people don't trust, like my mum, how can you trust this app, this computer? How do I know that this is right? Some of you may, if we like computers, so I trust computers, but again, that's one of the hurdles that we have to overcome. And now Hammerjam, would you like to take lead and discuss about how we can make the idea work?
Yes.
There you go.
Thank you.
I will jump in though, because you can't shut me up.
I'm less crazy. Yeah. Basically what we have here is the teledata infrastructure, or the topology basically. the assumption here is at any location, a field officer or a health personnel could be able to gather information and then be able to transmit it over an infrastructure, say GSM connectivity, or Wi-Fi, or GPRS, or Bluetooth, if it is within an immediate environment, depending on the application. And we tried to see what can we be able to add to the already existing system. We have an app developed by ASMA. We call it the Patel app. Yeah, it's an Android-based app.
They did it.
Yeah, it's an Android-based app. We added QR code functionality and RFID tag functionality to it. The app could be able to read it and be able to capture information. So basically, you can see the 9 sensors there and the existing eHealth app. If you add the Patel app, of course, you have what we call the Pri-Berry app. We can capture and monitor real-time data and update it dynamically, and transform raw data into meaningful patient information. So, for the sake of the future, coming in? Okay. Yeah. We feel there are a lot of room for improvement, and existing sensors could be integrated to it.
So that would be like if you already own a thermometer that's not hooked up to the
Exactly.
computer, it's cheaper.
Yeah.
So that could be one of the features that we could do. Have an app that you don't have to hook up the sensors yourself.
Yeah.
So we're trying to modify
Yeah.
existing.
And of course, increased level of security to guarantee data protection and all that.
Whoop, whoop.
Yeah,
He wants to finish.
So
I'm less crazy, remember?
this not true. We covered it.
Yeah.
The Patella, we use RFID.
Yeah.
So with the original eHealth app,
Yes. Okay.
with the original eHealth app,
Yeah.
it does not link the data to a person. So that was what we did with the RFID. So you can hook up the information.
Back again.
So this app, this
Yeah.
one.
Yeah.
This app. So you can use RFID or scan the QR code. So yeah, go forward again, backward.
Okay.
And again.
Again.
Yeah. Okay. So that's what we're saying. It's the original eHealth. It's not linked to anything. Good for home because you don't keep records. But what Chaz was mentioning earlier about N3, we're thinking of actually rather than having a database to use for health providers, which would be kind of local to them, we were thinking of possibly integrating it with trusted healthcare providers. So if a small hospital or a doctor's surgery would use it, then with it being tied to the NHS, to us that's our big healthcare provider, so it's trusted. So feel a bit more like, oh yeah, it's NHS, I trust. So it's okay. And then,
What do you have about the Austria?
so yeah, we've just wanted to mention, I added this in, Team Austria. We feel that their idea is kind of at the back of what we do. So this is the first stage, primary, but then if you find out you've got a heart problem, then that's where their idea connects to us. So kind of 2 jigsaw puzzles connecting together, that's what I could see. So I felt like that was one of the things that stood out to me. So yeah, and Beatles, and that means questions, but I don't know how to say it.
Kissing me, kiss it.
Yeah.